Hi, you're welcome to part of our Mensana Festival for 2021. We're here with Roy Elmes in the Cancer Support Centre here on O'Brien Road, and today we're going to be looking at cancer, the emotional roller coaster. So Roy, might start off the conversation with yourself in relation to what might happen for someone when they might be given a diagnosis, or even maybe before a diagnosis of cancer.
Yeah, I suppose if it's okay to say, Olive, you're very welcome here this morning, yes, to AIST, and just to say that, yes, AIST is a cancer support centre. I've been working here now for quite some time. I do person-to-person counselling, and I also work with groups. And AIST is, I'm just a cog in the wheel here. And, there's a great team here. I do great work, and very capably managed by Claire Healy, our manager. So that kind of, from there, I mean, we're straight into it here with the diagnosis, of course. Yes, that's the first thing.
I'm just wondering, Roy, just even as you say that, so is the Cancer Support Centre for just individuals who have a diagnosis, or is it for their families as well?
Yeah, it's yes, of course, it's more than just a diagnosis.
Okay.
It's for people who have been affected by cancer. Yes.
Okay.
Now, obviously, that means it's for the patient themselves, and it's for family.
Okay.
And it's for carers.
Okay. Yeah.
We are discovering, you know, the net is widening a bit, because we're becoming more and more aware of the impact on a cancer diagnosis on so many people in that person's life. You know?
And it's interesting, I suppose, as we talk about it, is that we've gone straight into the diagnosis. And just before we were talking, you were saying emotionally even, that before that there can be actually quite a lot of emotional things going on for people in relation to cancer.
Well, yes, of course, you know. Straight away, I'm going to emphasise that cancer diagnosis is grief, you know. It's very much associated with grief and loss. And I can explain a little bit more about that as we progress. But you're dead right, I mean, it's a huge thing for anyone to be diagnosed with cancer, because there's no point in beating around the bush. We more or less, most of the time, we think straight away around our mortality. Because cancer is a life-threatening illness, and that's the reality of it. And so it brings so many people into the net straight away. And when I say that, I'm then making it clear that a cancer diagnosis for a person is also a diagnosis for the family, the person's family. And friends. And whatever support structure that person has in their lives, you know.
You know, and as you say that then, Roy, is there a different range of emotions that might come up for people as they talk about a diagnosis?
I suppose if you go back to the diagnosis, we have the symptoms, right? Before the diagnosis. So the symptoms, because of the nature of cancer, it's a very sneaky disease. So you can have it on board, you can have it in your body a lot sooner than you're aware of. And we all know that, because people may feel a lump. You know, a woman may feel a lump in her breast. Now, the minute you feel that, you have to go through emotion straight away. What do I do here? Because the first thing that comes up is fear, and anxiety, because we live in a zone, I suppose, where it's always someone else that gets cancer. So we never want to think that it could be us.
When it comes to our door, per se.
So suddenly then, when it's on board, when we're up close and personal with it, again, it can be, as I mentioned, in the female area, it's mostly breast cancer, although there obviously are other cancers that are much more coming to the fore. In men, it can be prostate cancer. So the symptoms there can be frequency of going to the toilet at night and stuff like that, which can be going on for some time and may be prolonged, because deep down, that man knows that this may be more serious than they want to recognise. So there's a fear-anxiety factor very early in play, before even when the symptoms are there.
Very much, okay.
So yeah, so then it progresses that you go to your GP. The GP will accordingly do their examination, and they will refer, most of the time will refer the person on to a higher medical level, which will be a consultancy in a hospital or whatever.
Okay.
And that's when the diagnosis becomes part of the context, if you like.
Yeah.
You know.
And I suppose, as you mentioned, even that journey, you know, there can be quite a time, because for some people, if they're experiencing fear, for instance, that might freeze them for some time before maybe they'll go to check it out.
Yeah, you're dead right. I mean, that can be a factor, yes.
Okay.
It can be, because not everyone is going to just grab the bull by the horns, so to speak, you know. And they're going to maybe, and we know of people who have put it on the long finger.
Okay.
And unfortunately, that is detrimental. Okay. Because it's one of the biggest factors in surviving cancer is early diagnosis.
Okay.
Yeah.
Yeah.
And generally, people who are diagnosed earlier have a better chance of living, surviving, yes. Yeah. Which makes sense when you think about it,
for sure.
Yeah.
So I'm just wondering then around some of the emotional reactions people might have to actually being then diagnosed with a...
Diagnosis, I suppose the biggest one that comes through our door all the time is the shock of being diagnosed. Being told you have cancer. And shock is there for an obvious reason. It kind of causes us to feel a bit numb. You know, and we can be numb then very much emotionally and psychologically. Then we find it hard to get in touch with our feelings. But it's a numbness that is very much accompanied by fear and anxiety as well. It sounds like, as you're saying it, Roy, that might be a useful thing for people initially to have that reaction. Yeah, sure, it's there because it's a natural thing, exactly that, and it kind of cushions us from the full belt of being told you have a life-threatening illness. And I'm just thinking then, Roy, as you say that, then is there more in relation to, like, how does that develop, or the stages of a person's emotions around, we'd say, both their diagnosis and then quite quickly into treatment, maybe for some people, would it, you know? Yeah, it does. Another part of the diagnosis is that people can feel surreal. That this can't be happening to me, like, you know, this always happened to someone else. But so there's a denial, can be a denial factor there then, which is so human and so natural as well, you know. And so you progress then on a little bit further, because things start to take on a mind of their own then, because you're suddenly involved in scans and scopes and all the different examinations that come with a cancer diagnosis. You have to then, your life is very much occupied with decisions that you have to make. You know, a simple example of that is for a man who has been diagnosed with prostate cancer. There are so many different decisions to be made around that now that you know, it would be so easy to get just confused, like, you know, because and in line with that, a cancer diagnosis, one of the other things that it causes is that you don't suddenly feel as much in control as you would like to be. You know, we all like to feel we're in control in our lives, but suddenly, because of the nature of cancer, that is taken from us. It can be very much damaged, you know. You just don't feel as much in control anymore, and that's a fearful thing as well. So you're very much then more or less handing your life over to your medical team, the people who are now in charge of helping you to survive this. And this is a huge factor, because the medical people are so good at what they do.
Yes.
And they do it so well. But at the end of the day, that's their role, is to more or less look after the clinical medical side of it, yes?
Yeah.
And but then who's looking after the cancer patient in the context of their mental, psychological and emotional welfare?
Yeah. So it's nearly the two sides of it. So the medical side can be very well looked after, but the emotional side might need to be nurtured.
Well, these medic people do what they do, and I'm not being critical of them. They don't even have time to do the other side of it, to look after people's emotional and psychological well-being. They will do it, like in the context that they will be straight with the people, with the person, with the patient, and inform them, keep them informed as regards what has to be done, and encourage them and advise them as regards what they think would be the right thing to do. So, but at the end of the day, the cancer patient is, you know, in a state, I suppose, of confusion a lot of the time. And when you think about it, sure, it's perfectly normal and natural that would be the case. So people talk then about the battle in cancer. Yes.
Okay.
Yeah, of course there is a battle in cancer, but from my work and from my own experience, because I'm a cancer survivor myself, the big battle is in the mind.
Okay.
When it comes to cancer.
You
see, the medical people will look after the physical battle.
Yes.
You let them do that, and then they'll look after that side of it. But when that is taken care of, and everything kind of cools down, you're left wondering what has happened here. You know, it's like a bomb has gone off in your life, you know, and you suddenly are there trying to pick up the pieces. So,
because it's quite interesting hearing you talk. In some ways, Roy, as you're talking about, you know, the treatment and stuff, it's like people are just surviving it and living with their emotions. Would that be right, kind of, as it's evolving with it? Okay.
A huge part of this whole period is that you have trust in your medical team.
Okay.
And people generally do.
Okay.
So they more or less go with it. And whatever is advised for the person. It may be surgery, or it may be some form of treatment, radiotherapy, chemotherapy. But none of this is simple, like, you know, and it's basically, at the end of the day, you get through that. Because you kind of almost go on autopilot, and you front up for your appointments, for your chemotherapy appointments or your radiotherapy or whatever. If you've had surgery, you go through all that and you come out the other side of it, and it's then that's when the bomb drops. You really suddenly feel so much more on your own. You can feel quite lonely. A lot of people would allude to feeling lonely, you know, feeling stressed, very, very stressed and anxious, fearful. And oftentimes the one that we have to keep an eye on is the degree of depression. So when I mentioned earlier about the stages, a cancer diagnosis is grief straight away. It's a form of grief, Obviously it's not the grief that we all allude to, where we lose a loved one, but the stages are there just the same. The stages in grief are denial, anger, a bit of bargaining, depression, and acceptance. And if you think about all those, they can apply to a cancer diagnosis and what comes afterwards. So there will be a bit of denial. It varies from one person to another. Anger, how could you not be angry, like, because geez, look what has happened here. Like, here I was going along relatively smoothly, feeling in control of my life and not doing too bad, and suddenly this happens. And the unfairness of it then, you know. So you can be angry at yourself. You can be angry at yourself because should I have seen it sooner? You know, should I have picked up on it sooner? Most of the time that comes up quite a bit, because that causes a bit of guilt then, you know. And most of the time you wouldn't have seen it sooner because it's just so sneaky that, you know, it's just human like that. You don't be thinking, you know, we're not going to go around thinking all the time that we could get cancer, you
Yes,
know.
of course,
And
of course.
I'd encourage people not to do that, obviously,
Yeah,
you know.
yeah, yeah,
But
yeah.
be aware of, but be in control of that, you know. So sorry, where were we on what did you ask me then about the...
We were just, I suppose, looking at the stages of
well,
it.
the stages, anger, a bit of bargaining. So if you have a faith or whatever, you don't necessarily have to have a faith. If you're spiritual, whatever you're doing a deal with your higher power or whatever, look, I'll do anything, only just take this away from me, or the person, my family member, whoever, you know. Then depression is. It's a form of depression which needs to be kept an eye on, because it can sneak in there as well, and without being aware of it, you know. If you start to feel a little bit disinterested, you know, not feeling like doing anything, not doing the things you used to like to do, all these things are warning signs, you know, and feeling stuck. So that's important. It's hugely important that people look for a bit of help when if they feel that's happening to them. You know? And help is available.
Very much here.
Well, it's
obviously.
available. Of course. There's it's available here. We have the resources here to help people, and there's a number of cancer support centres, not, you know, and
of course,
not far away, like in Kilkenny, in Portlaoise, and Escort, you know. So wherever you are, just pick up the phone. Like it's probably one of the most important phone calls you can make. Like, you know,
to reach out. And I suppose as we've been talking, Roy, we've been talking a lot about the individual, you know, and I'm just wondering in terms of, you know, the support structures for people, like whether it be their friends or their family dependent, is it the same kind of emotional reaction that people, that their support structures have?
Oh yeah, I've yet to see it not, you know. I mean, a cancer diagnosis for the person, like I probably have said already, is a cancer diagnosis for the family. So the husband or wife is going to go through the whole gamut of emotions and everything that comes up as well, you know. And then sometimes you may be even more, because when you're a patient, you feel like you're cocooned in the care of the system and you're being looked after. But the loved one or your significant other or whoever, family member, mother, father, whatever, is very much a kind of almost a non-looker, really, and you can feel so powerless and helpless, and that's hugely hard to manage as well, because you would dearly love to be able to make a difference for the person you're caring for, you know. So yes, it is. It's grief for everyone, and also a significant part of the grief is around suddenly your life has changed irrevocably. A cancer diagnosis is a life-changing happening in your life. So you've lost the life that you had before you were diagnosed. Now, I'm not saying this in a negative way. I'm just making it clear that happens, and it doesn't have to be negative, but it is something that has to be managed and dealt with just the same. So the loss of the life that you had, because it is changed.
That's actually quite, you know, as you say it, I'm kind of really impacted by that people might have been going down a certain path, and now it's like, oh, so where do I go in my life? Often one that would often come up is, here we were and we've just lived our lives and worked hard all our lives and done all we could as regards getting us this far, and we're looking forward to our retirement, and this happens. One or the other is diagnosed with cancer, you know, one of the partnership, you know. And that's so hard to manage, you know. It is really. And of course, family members, like it's, there are parents come in here who have had children diagnosed, you know, and it's so hard, like, for people to manage that, because you're just frozen, like, with it, you know. It's so hard. You just can feel so helpless and powerless as well. And again,
some help is important, like, you know, and there is help there.
Yeah.
Around your emotions and your mental well-being, you know.
Yeah.
Yeah.
And I'm just, you know, even as we say that, Roy, because the range of emotions seems so broad that anybody could have. But it's like, is there any kind of techniques or things that might be supportive as people experience the emotional roller coasters that they might have? Is there any kind of techniques or things? So I'm hearing the one about talking and, you know, reaching out. Is there any other things that people potentially might do to support themselves with their emotions?
As in the person with cancer, how they do it, or people that...
both maybe, Roy, if we, you know, if anything comes to you.
Yeah, there are loads of techniques, you know, which, I mean, we're trying to do here in 20 minutes or half an hour, what there's whole books being written on, you know.
Yeah,
but I get what you're saying, yeah. I mean, there are techniques. I think it's important to talk to someone. It's important to talk to someone. It's important that you try and keep your life as normal as you can, if you like. Yeah. It's important that, you know, when those thoughts come into your head, that you try to manage them, like, and not find yourself going down the negative route all the time. You know, because a lot of the thoughts we have may never come into being. They may never happen. You know. So it's about a huge one is to get out for a walk if you're in a position to do that. Yeah? Just get out to the house and get out for a walk if you can at all. It's also important that you accept help if people offer it, you know. A lot of us are quite proud that way, and we bring that into our cancer diagnosis and what happens afterwards, and can be slow to, you know, ask for help because we feel like we're being a burden to people. And that can happen in a family context as well, that often the person who is the cancer patient in a family can actually go through an awful lot around that as regards the burden they are now to their family, and you know, you can actually feel so guilty about that as well, you know. And look what this has done now to the family system, you know, and everyone is walking on eggshells and worried, you know. It has tentacles out in all different directions.
I was just aware how broad it can actually go, and we're nearly back again to your first point a second ago, the importance of if you're feeling that, is maybe about coming back and talking to someone in relation to that.
Yeah, I mean, okay, I want to be very clear that it would be easy for me to use my counselling hat here, and it's hard not to. Because I'm quite passionate about it, and I see the difference it makes for people. So I mean, there's sadly counselling is still a bit stigmatized, you know. People are slow to go for help. And I am converted. I'm preaching that gospel, and I say to try and get past that and just go for help. I can testify all the time to the difference it makes, not just with me here, but there's other counsellors here as well. And generally people do very well from just coming and having a chat, you know.
And maybe it's the distance as well, Roy, because I'm aware that, you know, as you rightly said there, it's like also if one person gets a diagnosis, the family or friends are, you know, getting that diagnosis and are all dealing with their range of emotions. So in some ways that bit of having a bit of space to explore your own emotions is actually quite freeing, because if someone's feeling quite guilty, for instance, around something, or angry, because anger isn't one that we've said much around. I'm just wondering in terms of, you know, when anger comes in for an individual around a cancer you know, both maybe it's even the treatment or the diagnosis, does, you know, sometimes healthy expression of anger. I'm just wondering what's, you know, around cancer.
I suppose it's one that's quite, anger is quite subtle, you know, and it can even be there without realising it, you know. We can become angry in our behaviour towards ourselves or to others, and not really realise it, you know. But anger is quite toxic, like if it's not managed.
Okay.
And it's one of the main contributors, and I say this gently, it's one of the main contributors to depression, you know. Now I want to emphasize that when we talk about depression in a cancer context, it's feeling flat.
Right.
You know, we're not talking here of clinical form of depression. We're talking about like depression linked with serious illness, obviously, and low energy and everything that comes with that, because the battery usually ends up flat.
Yeah. Yeah.
After everything, you know, and then you're trying to make sense of things, and you don't really have the mojo, the energy there to do anything really. Yeah.
I was really caught with the bit that you said earlier, Roy, in terms of what was your norm before your cancer. So like trying to notice, what are you not doing what you used to do?
Yeah.
And that can be quite challenging, I'm sure, because maybe with your treatment and stuff like that, your body isn't able to do some of those things.
Absolutely, yeah. You're going to be, like I often use the analogy of the flat battery, you know. So it's about how you get some energy back into that battery, into the system again.
Yeah.
And that's a holistic battery, like it's psychological, it's emotional, and it's physical.
Yeah.
They're all very much linked together, you know, and just the awareness of that as well.
Yeah.
Because how could you not be, after everything that you've gone through, or if you're looking at a family member going through as well, like it applies very much the same. Okay, you don't have the treatment effects of that the cancer patient has, but you do have the emotional effects of it, you know, or the emotional side of it. Yes. So again, the grief. Going back to the grief, I suppose it's important that we kind of keep that in mind, because it is a big part of it all. Yeah.
Okay.
Yeah. And that there's a big loss factor here in so many different areas of the person's life, and that, you know. So, when grief hits our lives, we are who we are before it does. Yes. Yes. We're our personality, everything about us is there. Yeah. So grief suddenly lands into our lives, which it generally happens the way it does, like a cancer diagnosis or losing someone or whatever. So we bring that's who we are, and that's how we tackle it. Okay. Yes. Yeah. So if you're at last half-empty person, and someone insists on telling you, whatever you do now, think positive, doesn't generally go down very well. Okay. Okay. You know? Yeah. So we're into the area now of what do you say to a person who has cancer. I think, to be honest with you, it's probably one of the most difficult things to address, because it's possible that you can never say the right thing to a cancer patient. Okay. And that's not a criticism of the patient. It's just a fact. Yeah. You know, people generally feel a little bit insignificant or at a loss when you meet someone who's been diagnosed, and you'll blurt out something that may not be appropriate. You know. And it usually is something that's not appropriate, and that's not because the person intends it. Like people mean well.
The intention is good. The intention
but
is
oftentimes what they say isn't maybe the job. You know. Yeah. And you see, we want, with everything in our being, we want that person to be well. We want them to get better. Yeah. So we're naturally going to say things that we think will help them to be better. Yeah. It's an interesting one, isn't it? Yeah, because our instinct is to want to make, as you rightly said, to make it better. Absolutely. Yeah. And we all like to, and there are a lot more success stories around cancer now, a lot more. Yeah. And that's important to emphasize, you know, that a lot of people survive cancer now and go on to live long lives. And there are a lot of people too who are on a form of maintenance treatment, and they go on to live a long life as well, you know. Yeah, so people go on to live a normal life, you know. So it's important that that is emphasized too, you know, because it's a fact. It's a fact.
And just even as you say that, Roy, I'm just wondering, you know, for people who are, we'd say, long term, maybe with, you know, treatment that's very long term now, Is the emotional journey the same, or does it change if they're more on long-term treatment for cancer?
Yeah, it's amazing how resilient the human system is, you know, and people do learn to cope.
Okay.
Yeah.
Yeah.
They get into a way of living that copes with all this.
Yeah. Yeah.
You know, people can do that on their own, but they probably can do it better again if they get some help. You know.
Yeah.
It's so different. There's rarely two people who are the same. You know? But a lot of the factors around it are the same, like as in emotionally and psychologically. You know, it's important. It's very important. Say, for a person who may have a history of anxiety or depression, if they're diagnosed with cancer, to be aware of that as well, you know. So they may, because cancer on top of that may be a bit too much to cope with.
Okay.
So it's important to, you know, seek help. You know, talk to your GP or whatever. You know, come to a support centre. There is help there. You know, there's always help there. Yeah. And it's so important that there is an awareness around that. It's very easy to miss that, you know.
Yeah.
Also, we're kind of, you know, before we get maybe diagnosed, we have this idea in our heads that we're sort of bulletproof, like, you know, that if you've had a relatively healthy life up to then, you just think you are bulletproof, basically, you know, that nothing can knock you down.
Yeah.
Yeah.
And we're back then to that shock, the shock piece. Yeah,
exactly.
Yeah.
So, what do you do? Obviously, our first port of call is your doctor. Centres like AIST and, you know, I suppose it's also important that if you have a friend or someone whom you can talk to, it's good to talk to them as well. But it's not always the answer. Yeah. Because will be inclined to protect them.
Okay.
That's what happens in a family context as well. You know, you can see it happen quite often where most of the time where protectionism, what I call protectionism, kicks in. Yeah. So you're protecting, if you're the diagnosed person, or say I'm the diagnosed person, I'll protect my family members as much as I can.
Okay, so you might hide some of what
hiding, and you'll be, so it's all about, you know, that. And as a result, they'll do the same back. They'll protect you or me. Yeah. It's a human thing.
So they mightn't show what they're experiencing.
Exactly. Okay. So a lot of the time, the mask is on.
Okay.
And there's nothing more draining than having to wear a mask.
Yeah.
Every minute of every day. Yeah.
It's so complex, Roy. You know, even you know, the longer we're teasing out, it can be so, as you rightly said, it's so different for each individual. And then the layers, who we were before a cancer treatment or a diagnosis, will impact on how we are emotionally in our journey with cancer.
And how you manage it, how you deal with it. We use the word manage a lot because it's a good word to use. Okay. Because it gives us that sense, you know, when you repeat to a person, how are you managing? Are you managing, you know, different ways? It gives the person, or it gives you or me, a sense that we're maybe in a little bit more control.
Yeah. It's funny, as you said, I was thinking, well, I have some choices.
Yes.
I have some choices in this. Yeah.
Exactly. So, going back to protectionism, it's there, it's a human thing as well. How could it not be, you know? Because we're bound to protect the ones we love, you know, and that works. It's reciprocal, you know, it works both ways. So the problem with that is that then maybe things don't get said that maybe could be said. Okay. Not should be said, but could be said. You know? Yeah. And so communication gets a little bit fractured. So that leads me to say that's where talking to someone independent is so important. Yeah. Because you don't have to protect that person, you know. If someone comes into me, I will make it clear to them that you can say what you like to me here because I am trained and I have the experience to manage it, and I also get personal therapy as a result of the work I'm doing here. I have to, you know, for self-care. So it's important that that's emphasised, to go to someone independent, neutral if you like, who has experience. Join a group. That's a good one as well. You know, we have cancer survivors groups here as well, and generally you're there in the group. You're very much we're all in this together. So, and it's a fact that other cancer survivors probably get it a lot quicker than people who don't are not going through it. You know.
So that group support can be really important.
It's powerful. It's powerful, and we have it here in a bereavement context as well, and you can see how powerful it is, you know, in helping people to manage things a bit better, you know.
So Roy, we're actually coming to near the end of the time on our emotional roller coaster. So I'm just wondering if there's anything because I think like what's jumping out for me is that bit of how individual it is, the need, I suppose, to go on your journey, but also to acknowledge what you're experiencing, and if you're able to reach out. And also I think the support bit that you just finished with there is that sometimes talking to others who've experienced or are experiencing this can be really important.
It can. I suppose that fits with something that I'm thinking is so important. When you finish your treatment, and this will fit with your question, I hope, when people finish their treatment, you're cut loose then, Up to then, you're in almost feel cocooned in care, and the routine is there. You're going to your chemotherapy on the specified dates and all that. Suddenly then that finishes, and you're cut loose. And what we find here a lot of the time, that's when people really suddenly hit a wall. Because you're suddenly on your own, and you're trying to put the pieces back together again in your life, you know, and try and get back to some degree of normality. And that's when a lot of people find it very, very, very difficult in that period. And it makes sense when you think about it, So it's basically around how you manage your life, how you're... There's another thing in that. When you finish treatment, you're trying to manage in your head now everything that has happened and everything that you would like to happen, how we put your life back together. But oftentimes it doesn't just work like that, because the battery is flat. A lot of the time you don't have the energy. So you're struggling with that emotionally and psychologically. That energy is just not there. And then there's an expectancy in yourself that you should be up and running straight away, and everything is good, and we're over this and get on with it, And actually there's an expectancy then in your family and in your community that you should be doing the same thing.
Back
What's wrong with you? Sure, it's all over, look. You've done great, you're over it, get on with it, you know. But sure, it doesn't work like that. It just... It can't work like that. But that creates a huge pressure in the individual then, in the cancer patient survivor then. Because they start to point a finger at themselves then, and, you know, become far too hard on themselves, So I will say to people all the time, have you ever tried being kind to yourself? And we need to do that in any kind of grief. We need to work on that side of things, that we can start to be a little bit kinder to ourselves, We're not very good at that, if you think about it, you know. We are very, I suppose it's the way society is now, and it's the nature of it, that we can be quite hard on ourselves. We can be our own biggest judges. We can be, I suppose, another way of saying being kind to yourself is to be less hard on yourself, be less demanding on yourself. And that's why it's so important when you're emotionally and psychologically a kind of zapped, you know, just not in it. It makes perfect sense that you would be kind to yourself and be less demanding on yourself. And just
the way I've heard that, Roy, sometimes is put is to be your own best friend.
Yeah.
How would you
Yeah,
be
that's a
if it
good way of
was,
putting it,
you
yeah.
know?
Yeah.
So Roy, I just want to take this opportunity to thank both yourself for supporting the Carlow Mental Health Association during Mensana, and also, you know, to really promote the Age Cancer Support Centre here on O'Brien Road. And I suppose for the public is to encourage you to tap into the other events that are running for Mensana, which are all advertised both on our Facebook page and on our website, carlowmentalhealth.ie.